Fracture, Things You Should Know, Questions and Answers by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Fracture, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of different types of fractures. Chapter 1. 1. What is a bone fracture? A bone fracture is a crack or break of a bone. 2. What are the causes of a bone fracture? A bone fracture could be caused by a mechanical force such as a trauma, injury, and diseases. 3. Give an example of a trauma that can cause a bone fracture. An example of a trauma that can cause a bone fracture is a fall. 4. What kind of diseases can cause a bone fracture? Osteoporosis and bone cancer can cause a bone fracture. 5. What is osteoporosis? Osteoporosis is a rapid loss of bone density. 6. What is a joint? A joint is a place where two or more bones meet. 7. What is the soft internal layer of a bone? The soft internal layer of a bone is the spongy bone. 8. What is the hard external layer of a bone? The hard external layer of a bone is the cortical. 9. What is the layer of the bone that covers the cortical? The layer of the bone that covers the cortical is the periosteum. 10. Does periosteum surround all parts of a bone? No, periosteum does not surround all parts of a bone. Chapter 2. 1. What part of the bone does the periosteum not surround? The periosteum does not surround the areas of a joint. 2. What is the periosteum mainly made up of? The periosteum is mainly made up of collagen and nerve fibers. 3. What is the inner cellular layer of the periosteum? The inner cellular layer of the periosteum is the cambium. 4. What is osteon? Osteon is the structural unit of a cortical bone. 5. What are osteoblasts? Osteoblasts are cells involved in bone formation. 6. What are osteoclasts? Osteoclasts are cells involved in bone degradation. 7. What is epiphysis? Epiphysis is the round tip of a long bone. 8. What is diaphysis? Diaphysis is the main part of a long bone. 9. What part of the bone is between the epiphysis and the diaphysis? The metaphysis is between the epiphysis and the diaphysis. 10. What is contained in the metaphysis? The growth plate is in the metaphysis. Chapter 3. 1. What is the function of the growth plate? The growth plate grows during childhood. 2. Who heals faster after a bone fracture, children or adults? Children heal faster than adults after a bone fracture. 3. Why do children heal faster than adults after a bone fracture? Children heal faster than adults after a bone fracture because the periosteum of children is stronger and more flexible compared to the periosteum of adults. 4. What is a dislocation? A dislocation is a situation in which a bone separates from a joint. 5. What is another name for a dislocation? Another name for a dislocation is luxation. 6. What is the function of a tendon? A tendon attaches a bone to a muscle. 7. What is the function of a ligament? A ligament attaches a bone to another bone. 8. What is hematoma? Hematoma is when blood escapes from blood vessels usually caused by an injury. 9. What is necrosis? Necrosis is the death of cell tissues. 10. What is an abscess? An abscess is an accumulation of pus. Chapter 4. 1. What are the types of bones? There are long, short, flat, and irregular bones. 2. What are the types of bone fractures? The types of bone fractures are open, closed, complex, incomplete, green stick, comminuted, transverse, oblique, and spiral fracture. 3. What is an open fracture? An open fracture is a fracture that occurs when the bone breaks and penetrates the skin. 4. What is another name for an open fracture? An open fracture is also called a compound fracture. 5. What is a closed fracture? A closed fracture is a fracture that occurs when the bone breaks but does not penetrate the skin. 6. What is another name for a closed fracture? A closed fracture is also called a simple fracture. 7. What is a complete fracture? A complete fracture is a fracture in which the bone is completely broken and separated. 8. What is an incomplete fracture? An incomplete fracture is a fracture in which the bone is partially broken. 9. What is a green stick fracture? A green stick fracture is a fracture in which a side of the bone is bent while the other side is broken. 10. Is a green stick fracture complete or an incomplete fracture? A green stick fracture is an incomplete fracture. Chapter 5. 1. What is a spiral fracture? A spiral fracture is a fracture caused by a twist of the bone. 2. What is a transverse fracture? A transverse fracture is a fracture that traverses the bone at a 90 degree to the axis of the bone. 3. What is a comminuted fracture? A comminuted fracture is a fracture where the bone is broken down into many fragments. 4. What is an oblique fracture? An oblique fracture is a fracture in which the bone breaks diagonally. 5. Is an oblique fracture a complete fracture or an incomplete fracture? An oblique fracture is a complete fracture. 6. What is a non-displaced bone fracture? A non-displaced bone fracture is when the bones of the fracture do not move. 7. What is a displaced bone fracture? A displaced bone fracture is when the bones of the fracture move. 8. What is a linear fracture? A linear fracture is a vertical fracture. 9. What are the signs and symptoms of a bone fracture? The signs and symptoms of a bone fracture are pain, swelling, deformity, bleeding, bone protruding from the skin, bruising, difficulty moving the fractured area, edema, crackling sound, etc. 10. What are the complications of bone fractures? The complications of bone fractures are nerve damage, infection, embolism, etc. Chapter 6. 1. What are the stages of a bone fracture repair? The stages of a bone fracture are hematoma, fibrocartilaginous callus, bony callus, and remodeling. 2. What happens during the hematoma phase of a bone fracture repair? During the hematoma phase of a bone fracture repair, hemorrhage occurs, then there is the formation of clotted blood. 3. What happens during the fibrocartilaginous callus phase of a bone fracture repair? During the fibrocartilaginous callus phase of a bone fracture repair, there is bone regeneration. This usually takes place in a couple of days, about 2 or 3 days. The bone regeneration takes place through the actions of fibroblasts and osteoblasts. 4. What happens during the bony callus phase of a bone fracture repair? During the bony callus phase of a bone fracture repair, the fibrocartilaginous callus is turned into a bony callus of spongy bone. This process takes a longer time, about 2 months. 5. What happens during the bone remodeling phase of a bone fracture repair? During the remodeling phase of a bone fracture repair, the bony callus is remodeled by the actions of osteoclasts and osteoblasts. This process takes several months. 6. What should be done immediately after a fracture? Immediately after a fracture, the fractured area should be immobilized as much as possible. 7. How is a fracture normally diagnosed? A fracture is normally diagnosed with an X-ray. 8. What is the use of ice during a fracture incident? Ice prevents swelling during a fracture incident. 9. What is an analgesic? An analgesic is a drug that relieves pain. 10. Give an example of a common analgesic for the treatment of a fracture. The administration of morphine is a common example of an analgesic used for a fracture treatment. Chapter 7. 1. What is compartment syndrome? Compartment syndrome is when there is a high pressure in a muscle compartment. 2. What is paralysis? Paralysis is the loss of muscle function. 3. What is the cause of paralysis? Paralysis can be caused when there is damage to nerve cells. 4. What is pallor? Pallor is an abnormal pale appearance of the skin. 5. What is the cause of pallor? Pallor is caused by a decrease in blood supply to the affected area. 6. What does my mean in osteomyelitis? My means marrow. 7. What is osteo? Osteo means bone. 8. What does itis mean in osteomyelitis? Itis means inflammation. 9. What is osteitis? Osteitis is an inflammation of the bone. 10. What are the signs of an infection? The signs of an infection are pain, swelling, redness, heat, fever, malaise, etc. Chapter 8. 1. What is hypothermia? Hypothermia is when the body's temperature is above the normal body temperature. 2. What is poikilothermia? Poikilothermia is the inability of a person to regulate his body temperature. 3. What is tachypnea? Tachypnea is a fast irregular breathing condition. 4. What is tachycardia? Tachycardia is an irregular heartbeat rate. 5. What is paresthesia? Paresthesia is a neurological condition that causes sensations such as burning, prickling, tingling, and numbness on the skin. 6. What is petechiae? Petechiae is a skin condition caused by bleeding under the skin. 7. What is pulselessness? Pulselessness is the absence of pulse. 8. What is fascia? Fascia is the connective tissue that surrounds and supports every organ and cell of the body. 9. What is fat embolism? Fat embolism is the presence of fat in the bloodstream. 10. What is a major sign of fat embolism in a patient with a fracture? A major sign of fat embolism in a patient with a fracture is a change in their mental state. Chapter 9. 1. What is hyperhidrosis? Hyperhidrosis is an abnormal excessive sweating. 2. What is tetanus? Tetanus is a bacterial infection that causes spasms in the muscles. 3. Is tetanus infection painful? Yes, tetanus infection is very painful. 4. What are the signs and symptoms of a tetanus infection? The signs and symptoms of a tetanus infection are extremely painful contractures, hyperhidrosis, hypothermia, difficulty swallowing, and hypertension. 5. What is staphylococcus? Staphylococcus is a gram-positive bacterium. Chapter 10. 1. What is attraction? Attraction is a technique used to realign a fracture. 2. What is osteosynthesis? Osteosynthesis is a treatment aimed at the stabilization of a bone due to a fracture. 3. What are the materials used during osteosynthesis? The materials used during osteosynthesis are screws, rods, plates, and external fixation device. 4. What is an internal fixation device? An internal fixation device is a device that is attached to the bone and is inside the skin. 5. What is an external fixation device? An external fixation device is a device that is attached to the outside of the skin. 6. When is an external fixation normally indicated? An external fixation is normally indicated when a fracture is very complex and does not allow internal fixation. 7. Can an internal fixation device be adjusted? No, an internal fixation device cannot be adjusted. 8. Can an external fixation device be adjusted? Yes, an external fixation device can be adjusted. 9. What is a bone reduction? A bone reduction is placing a bone back to its origin. 10. There are how many types of bone reduction? There are 2 types of bone reduction. 11. What are the types of bone reduction? The types of bone reduction are open bone reduction and closed bone reduction. 12. What is an open bone reduction? An open bone reduction is a reduction performed surgically. 13. What is a closed bone reduction? A closed bone reduction is a reduction performed manually. 14. What is usually placed on an area after an open bone reduction? After an open bone reduction, a fixation device is usually placed on the area. 15. What is usually placed on an area after a closed bone reduction? After a closed bone reduction, a cast is usually placed on the area. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding the different types of fracture.